Hello friends, so our today's topic is a very common topic and it is an extremely important one. It is alcoholic liver disease. So we all are aware of the fact that chronic consumption of alcohol could damage our liver. And we also know that quitting alcohol can keep our liver healthy. But do we actually know what are the functions of the liver? So our liver is one of the most important organs of the body and it has over 500 functions. And these are the most important ones. So it has an important role in the immunity of the body. It creates blood clotting factors and destroy old or damaged blood cells. It has an important role in the metabolism as well, as it creates bile, breaks down fats, proteins, etc. and it's involved in regulation of blood glucose. It also stores fats, proteins, glycogens, copper, iron, etc. So we know that alcohol consumption directly causes damage to our liver. And there are a lot of people who need help with it. So they should know that we can help our liver by taking a break from alcohol. So giving up alcohol for just a month also can improve our liver function, decrease blood pressure and reduce the risk of liver disease. So what is cirrhosis? Cirrhosis of the liver is one of the 10 leading causes of death in the Western world. It has 4 features, and alcoholic cirrhosis, also known as alcoholic liver disease, is one of the etiological classifications. So why did I actually bring cirrhosis in between alcoholic liver disease? So these two are actually connected. Cirrhosis is a long-term scarring of the liver, so the liver stops working normally and men are more susceptible to it than women. So one of the most important causes of it is alcoholic abuse and it is very common. That's why these two are really interconnected. So this is the normal liver. This is a picture showing the connection between alcoholic consumption and cirrhosis. So this is a normal liver, and when there is chronic and excessive alcohol consumption, it leads to steatosis, which is nothing but alcoholic fatty liver, which causes steatohepatitis or cirrhosis directly, and steatohepatitis can lead to cirrhosis or hepatocellular carcinoma. So as you can see, it mainly leads to cirrhosis or hepatocellular carcinoma. But this is a good thing that abstinence from drinking alcohol can actually reverse these things and cause normal liver. Again, alcoholic liver disease and cirrhosis. So it is a spectrum of liver injury associated with acute and chronic alcoholism. So this is the connection between alcoholic liver disease and cirrhosis. It has 3 stages: alcoholic steatosis, which is nothing but fatty liver, alcoholic hepatitis and alcoholic cirrhosis. So this is the effects of heavy drinking, as we've already seen: cirrhosis, fatty liver and hepatitis. So this is a pictorial representation of the chances of causing these steatosis, hepatitis and cirrhosis. So now we're going to learn about the metabolism of ethanol. 1 gram of alcohol produces 7 calories, but then these calories can't be stored in our body, so these are actually just waste calories. And 90% of ethanol is oxidized to acetate by ADH, which is present in cytosol, and by ALDH, which is present in mitochondria. And 10% of which is oxidized elsewhere in the body. So it is a 2-step metabolism. So this is a pictorial representation of what I just told you. Ethanol, which is consumed by drinking alcohol. In the presence of alcohol, dehydrogenase, which is nothing but ADH, produces acetaldehyde, and this in the presence of acetaldehyde dehydrogenase produces acetate. So this is the first step of the metabolism. So ethanol is catabolized to acetaldehyde in the liver by 3 pathways. 1 of it is major and 2 minor. So the first one takes place in cytosol by major rate limiting pathway of ADH. Second one in the endoplasmic reticulum via microsomal P450 oxidases. Part of ethanol is oxidized by the second one. And third one in the peroxisomes, it is a minor pathway via catalase such as H2O2. So acetaldehyde is actually toxic and cause membrane damage and cell necrosis. And while these steps are taking place, simultaneously NAD is also reduced to NADH. This is the second step. So acetaldehyde to acetate is converted in the mitochondria and ALDH acts as a coenzyme. And most of the acetate is oxidized to CO2 and H2O or converted to fatty acids through the citric acid cycle. Simultaneously again NAD is reduced to NADH. So there's increased NADH is to NAD redox ratio, and this is the basic chemical change in the ethanol metabolism. So this is again a flow chart showing the two steps of the ethanol metabolism. Risk factors. So incidence of cirrhosis is 10 to 15%. So not every alcoholic develops cirrhosis. And these are the risk factors: drinking pattern, gender, malnutrition, infections, genetic factors, and hepatitis infections. So we're going to see each of these individually. Drinking patterns. So chronic alcoholism obviously is one of the most important risk factors. So it produces fatty liver in more than 90% of the cases, then alcoholic hepatitis in 10 to 20% of the cases, and finally alcoholic cirrhosis over 10 years. So every day 60 to 80 grams of ethanol for 10 years leads to alcoholic liver disease. It also depends on the quantity and duration of ethanol consumption. So beer consists of 4 to 6% of ethanol, wine consists of 10 to 12% of ethanol, and brandy, whiskey and scotch consists of 40 to 50% of ethanol. Though intermittent drinking for long term is less harmful as the liver gets time to heal itself. So this image shows the unit of ethanol present in each of these drinks. Gender. I know this sounds very sexist and not fair, but then women are more susceptible to alcoholic liver disease. So just 20 to 40 grams of consumption per day can lead to alcoholic liver disease in women, whereas it's not the case in men, as we've already seen that 60 to 80 grams of ethanol consumption causes alcoholic liver disease in men. The reason is not really known, but it may be because it's linked to effects of estrogen. This could be because there's higher body fat percentage in women and they metabolize alcohol less efficiently, and this results in women being more vulnerable to liver disease, heart disease and brain damage. Malnutrition. Malnutrition of proteins and vitamins is a contributory factor to it, and calories from alcohol displace other nutrients leading to malnutrition and deficiency of vitamins. This is proved by improvement in cases on treatment with protein-rich diets. So this is a flow chart explaining what I just told. So alcohol consumption can cause direct toxicity to the liver and to the stomach and intestines. Or the empty calories produced by the alcohol, which we've already learned about, can cause malnutrition, and this results in functional impairment of the liver and the stomach. Infection. Bacterial infections are very common and it may accelerate the course of the disease. Lesions similar to alcoholic cirrhosis develop in non-alcoholic patients with viral infections in the past. Genetic factors. Rate of ethanol metabolism is regulated by genetic control, and it is related to genetic polymorphism of two main enzymatic enzymes, which are MEOS and ADH. So this is why Europeans are less vulnerable to alcoholic liver disease than Asians. Hepatitis infections. It is an important risk factor for progression of the disease. It leads to disease with much less alcohol consumption, and disease progresses at a much younger age, greater severity and increased risk to develop cirrhosis and hepatocellular carcinoma and the overall poorer survival. So a person having hepatitis B or C infection is more prone to develop alcoholic liver disease even by very less alcohol consumption. So now we come to the most important part of our topic. It is pathogenesis of it. So first one is direct hepatotoxicity by ethanol. Ethanol ingestion for 8 to 10 days regularly cause direct hepatotoxic effects on the liver. It produces fatty changes and directly toxic to microtubules, mitochondria and the membranes of the hepatocytes. Hepatotoxicity by ethanol metabolites. So acetaldehyde is a major toxic metabolite and its levels are elevated in chronic alcoholics. They produce two adducts, production of proteins, aldehyde adduct, which is extremely toxic and cause cytoskeletal and membrane damage and bring hepatocellular necrosis and formation of MAA, which produce antibodies and initiate autoimmune response in the body. Oxidative stress. Oxidation of ethanol by cytochrome 450 leads to generation of free radicals which cause oxidative damage to the membrane and proteins. Immunological mechanisms. The cell-mediated immunity is impaired and ethanol causes direct immunological attack on hepatocytes. Continues unabated despite cessation of alcohol consumption as it's attributed to immunological mechanism. Inflammation. Ethanol ingestion damages intestinal cells. These release endotoxins which release pro-inflammatory cytokines. These cytokines and endotoxinemia produce apoptosis and necrosis of hepatocytes and initiate inflammatory reaction in alcohol-damaged liver. Fibrogenesis. It is facilitated by activation of stellate cells by various stimuli like damaged hepatocytes, malondialdehyde acetaldehyde adducts activated by Kupffer cells and direct stimulation like acetaldehyde. Increased redox ratio. As we have already seen, increased NADH-NAD redox ratio in hepatocytes results in increased redox ratio of lactate pyruvate and this leads to lactic acidosis. It is seen in many other cases too. Retention of liver cell water and proteins. Alcohol inhibits secretion of newly synthesized proteins leading to retention of proteins followed by water in hepatocytes. This leads to hepatomegaly in alcoholics. Hypoxia. Chronic alcohol ingestion results in increased oxygen demand by liver resulting in a hypoxic state. This causes hepatocellular necrosis and it is mostly seen in the zone 3 of the liver. Increased liver fat. In chronic alcoholism, there is increased amount of fat available which could be from exogenous sources, excess mobilization from adipose tissue or increased lipid synthesis by liver itself. This accounts for lipid accumulation in hepatocytes. Morphological features. As we've already seen, alcoholic liver disease causes alcoholic steatosis, alcoholic hepatitis and alcoholic cirrhosis. So this is the same thing what I just told you. Now let us see the diagnosis of alcoholic liver disease. So there's elevated transaminase and there's increase in AST more than ALT, rise in serum alpha glutamyl transpeptidase, elevation in serum alkaline phosphate, hyperbilirubinemia, hyperproteinemia, prolonged prothrombin time and partial thromboblastin time, anemia and neutrophilic leukocytosis. So this is a summary of what we just learned. Alcoholic liver disease is a non-transmittable liver disease due to excess intake of alcohol. The chronicity ranges from harmless and reversible to alcoholic hepatitis and alcoholic liver cirrhosis, and the prevention of it is nothing but stop drinking too much alcohol. Symptoms include dry mouth and increased thirst, abdominal pain and swelling, yellowing of skin and eyes, this is due to jaundice, and weight loss. And risk factors, as I've told you, the major risk factor is alcohol abuse. So I hope we do ourselves and our liver a favor and stop damaging our liver by stop consuming alcohol. Thank you so much.